Our final guest is Sara Brown, nurse practitioner with Novant Health OBGYN. Well, welcome back to the show, Sara.
Thank you. Thank you for having me.
It's a pleasure to have you again.
Thank you.
And for our viewers out there who might have missed you the last time you were here, tell us a little bit about your education and your background.
Oh, sure. I am a nurse practitioner.
Yes.
Formerly went to nursing school at Rex in Raleigh, which was a 3-year program at that time. Worked for a few years in the emergency room primarily. Back then it was emergency room, not emergency department. And then went to nurse practitioner school at Chapel Hill. Graduated in '79 and have been working as a nurse practitioner since.
Well, great. Thanks for the reminder.
Yes, ma'am.
Now, I know you're with Novant Health
Yes.
OBGYN.
Yes.
And I believe you have a few other partners there.
Oh,
so
yes.
let's talk a little bit about who those partners are.
We have 4 wonderful physicians at present. Dr. Tracy McCarthy is a senior partner. Dr. Lee Toller is also there, and Dr. Lee Shu. And as the practice continues to grow, we are anticipating having more physicians join us in the future. So that we're looking forward to that.
I hear it's really growing quickly.
It is. It really is. It's been wonderful to see. We have wonderful patients and wonderful services to offer, and we're delighted that the community is responding beautifully.
Yeah, they're embracing that
Yes.
practice. Well, let's talk about the services that are offered at Novant Health OBGYN.
Of course, being primarily and essentially OBGYN,
Right.
anything that's female related. In the past, a lot of women have used their OBGYN physician as their primary care provider.
Right.
Which,
I'm one of those.
Me too. And that has become a little more specialized. So traditionally, it's basically female and female-related issues. There are some things that if we can help a patient manage in a transition period as they're either establishing with a new primary care provider or something, there are always options. But that's our main, is the female health and well-being of women of all ages.
At what age do you start seeing females?
I actually have seen patients as young as 8 or 10.
Really?
But that would be an unusual situation or a referral for some reason. And I think the oldest female that I've seen was in her 90s.
Wow. So we start when they're teenagers or even younger, and through the baby booming years, and then on into menopause.
And I have found that a lot of our younger patients are a bit fearful because they think if they're coming to a gynecology office that they're going to have a pelvic exam, and that's not necessarily true.
Really?
Often it's just let's find out what's going on, talk, and it doesn't have to be anything that they need to be afraid of.
Well, speaking of services and exams and what have you, as a nurse practitioner in the office, what role do you play?
I do a lot of the new OB visits, the interviews and exams. We also have Annika McNichol, who's one of our senior nurses, is doing a lot of the interviews now.
Oh.
And so I see most of the new OBs for their exams, and we'll follow what we would consider a routine OB until around 36 weeks, and then they start meeting with the other physicians. Of course, if they prefer or need to see a physician, that's always an option.
Right.
But I do routine, health and well-being exams, pelvic exams, pap smears, biopsies,
Wow.
that sort of thing.
Pretty much everything.
Yeah, it's a nice spot to be in.
Wow. Well, today we're going to talk about endometriosis, since March is the Endometriosis Awareness Month.
Right.
And first of all, I guess you need to tell me and our viewers what endometriosis is.
Right. The simplest way I found to explain it to patients, and it's simple for me to understand, is that for some reason the lining of the uterus gets kicked into high gear, and we're not sure why. And therefore the lining of the uterus that's maintained mainly in the uterus and stays there, and we slough some of the lining, goes into high gear, and there are areas that come out and implant in the peritoneum or in the pelvic cavity and even in the abdominal cavity, and cause problems with scarring, and adhesions are developed, which is when tissues kind of bind together and can create problems with pain and irregular periods, infertility, urinary problems, bowel problems. It can be pretty impressive.
So the symptoms are what you just mentioned,
Exactly.
then the pain.
Some people have pain only with periods. Some people only have pain with intercourse. Others have pain that is intermittent, but primarily with menstruation. Those who have chronic pelvic pain are often difficult for the patients themselves to manage because you have to figure out what's going on. We assume as women that if we have pelvic pain, it's got to be female related, and often that's true, but not always. So it can be frustrating for patients at times to go through the process of ruling out bladder, ruling out intestine, but it's a process and it's manageable.
And speaking of manageable, how would you manage that?
It can be managed and hopefully lower pain issues using traditional birth control pills to suppress the ovaries and the endometrial development. Use injections like Depo-Provera or even Depo-Lupron, which puts women into a chemical menopause and just stops the process. And we also use anti-inflammatories like ibuprofen or naproxen, which we use at prescription strength. And so there are options.
Well, by having a hysterectomy, would that cure it?
That is the hope, though you can never actually say it's going to cure it.
Really?
We always tell women, that's our hope, that's our gain, or the aim. But if there's even a tiny bit of endometrial tissue that can't be retrieved, then it can continue to grow. So the hope is that, yes, that will resolve the pain and end the pain. And I would say for the majority of women it does. And that's a definitive treatment for women who are, of course, through attempting their childbearing years.
Sure. Well, are there tips that you can give our viewers out there? If they think they have or may suffer from endometriosis, what tips might you offer?
They need to see their provider. And there is a slight increased risk in women whose mothers or sisters have endometriosis. They have a slight increased risk. And it's mainly seen in women in their mid-20s to early 40s. But if you have symptoms of difficulty with urination, difficulty or pain with stooling, painful periods, that sort of thing, we just need to know.
Well, that's great information. I think it's probably not a well-known topic out there in the viewer world. So I think it's great to have that discussion here.
Yeah. Women also need to know that their level of endometriosis, which is graded, grades 1 through 4, their pain is not reflective of how bad their endometriosis is.
Really?
A person who can have grade 4, which is pretty impressive implants in the pelvic area and endometrial area, may have minimal pain.
Wow.
And yet someone with a lesser area of involvement may have more significant pain, depending on where it is.
Wow. It seems like it would be the
opposite. It seems frustrating. It seems like it's
frustrating,
daunting, but it's manageable.
Well, great. That's good to hear. Getting back to you personally, do you have any special interests that you like to address or special areas that you would like to discuss with our viewers?
Sure. I enjoy adolescent and teen GYN care. I love obstetrics. I really do. I enjoy that. I also enjoy the geriatric population because I'm there now. And
it makes it easier when you're there.
It does. I can certainly understand and appreciate
where they're coming from.
Absolutely.
Right? Yeah.
And we're fortunate. All the physicians in our group have wonderful skill sets. And
well, they have excellent reputations.
They do.
In town.
I'm delighted to be part of that practice.
That's awesome. Well, are you accepting new patients?
Yes, we are.
Great.
Yes, we are.
And how would we go about scheduling an appointment with you specifically?
Just call our office number, which is 910-721-4050, and they can make an appointment with the provider of their choice. They don't have to see me. If they choose, that's certainly an option.
Well, that's great. Before we close, is there anything else you would like to add, like to say to our viewers?
No, it's just we are here to serve our female population needs, and we don't just focus on the female because I hope that we are looking at the entire family. Especially with our OB patients and the women who have endometriosis with chronic pain. It's a family involvement with their partners or spouses, and so it's something we like to focus on everyone, but provide the best care we can.
Great. Well, it was such a pleasure to have you back on the show. It's always a pleasure to have you here.
Well, I enjoy seeing you too. Thanks.
Great. Well, come back soon.
I will do it.
All right.